Poisoning can be dangerous and sometimes even deadly. My name is Dr. Jim Yang. I'm an emergency physician at the Ottawa Hospital. Here's what you need to know if you think you or someone you know has been exposed to something poisonous. An exposure can mean contact with any substance that can be harmful, whether it's swallowed, inhaled, absorbed through the skin, or splashed in the eyes. It can happen intentionally or by accident. Sometimes the signs of poisoning aren't obvious, but you might notice things like sudden vomiting, trouble breathing, confusion, or burns around the mouth. If you suspect poisoning, it's always best to act fast. Start by staying calm. It's one of the most important things that you can do. Try to figure out what the poisonous substance might be. Was it something swallowed? A chemical on the skin? Fumes that were inhaled? Next, you need to call for help. If the person suspected of being poisoned is awake and alert, call your local poison center right away. In Ontario, the phone number is 1-800-268-9017. If you don't know the number for your local poison control line, if they start to pass out, have trouble breathing, or seem confused, call 911 immediately. There are some important things for you to keep in mind for the person who is poisoned. If the poison was swallowed, don't make them throw up unless the poison control tells you to. Vomiting can actually make things worse. Unless you're told otherwise, don't give them anything to eat or drink, and definitely do not try to treat it with home remedies. If it's a chemical on the skin, put on gloves if you can, and rinse the area gently with water, just water, for 15 to 20 minutes. If a harmful substance was inhaled, move them to fresh air right away. Open the windows or get outside if it's safe to do so. If it's possible, hang on to the product label or container you suspect caused the poisoning. This will help poison control or the paramedics know exactly what they're dealing with. Now, poisoning can be serious, but your quick action can make all the difference. If you want to be ready for more emergencies, check out the next video in our emergency first aid series.